Welcome to this week's webinar with the Education Coordinator, Sara Flack at the Child Advocacy Center of the Finger Lakes. For this week's webinar, I'll be discussing medicals for sexual abuse survivors. I wanted to start just by sharing this quote from a survivor named Barbara. She says, "I don't want anyone to be alone when they're going through something traumatic. It simply doesn't fly in my world." And what she's talking about is the support that she received while she was going through her medical exam after being assaulted. It's important to understand that there are two types of medical exams that can be conducted after a sexual assault. The first one, a SAKE or a SAC, stands for Sexual Assault Evidence Collection Kit. This is what we will be talking primarily about today in this webinar. These are also commonly referred to as rape kits, and they can be performed by medical providers. However, being performed by a SANE nurse is ideal. At Thompson Hospital in Canandaigua, they have a terrific SANE program, and I will discuss more about that in a few moments. For a rape kit, the timeline is extremely important. An oral and anal exam can only be done within 24 hours, as those areas of the body heal incredibly quickly. Within a 72-hour range is when HIV prophylaxis can be administered to help prevent the risk of HIV and AIDS. Within 96 hours of the assault, we can still perform a toxicology report of the victim. 120 hours is the absolute maximum amount of time where we may be able to still collect evidence, administer STD prophylaxis, and pregnancy treatment. However, the sooner that an individual who's been victimized gets to the hospital for an exam, the better. This is because not only will they have more physical evidence that can be collected, but they can also receive key medications and prophylaxis to avoid any risk to their health. This exam typically takes anywhere from 3 to 6 hours to complete. It varies tremendously based on the actual circumstances around the assault. And not all steps are always necessary. Depending on the degree of assault, whether there was penetration or not, we may be able to skip certain steps in the collection. If not all steps are deemed necessary by the medical provider, this will drastically shorten the amount of time it takes to complete a SANE exam. The other type of exam that we commonly come into contact with is the REACH exam. This is a referral and evaluation service for abused children. When we have children who have experienced sexual abuse or extreme physical abuse outside the 5-day window, we would still want to refer them for some medical treatment. Because they are no longer going to require a SANE exam, we would refer them typically for a REACH referral up to the Bavona Child Advocacy Center in Rochester. Here they perform psychosocial assessments as well as medical examinations. It is quite a bit shorter of a visit than a full SANE exam. However, many things are covered. At a REACH appointment, doctors will meet with the caretakers, if it's deemed appropriate, to cover the child's medical history. After medical history is gathered, they will perform a general physical exam, which is basically the same as a well child visit. From there, they will use a colposcope and possibly collect cultures from the child. A colposcope is a special microscope that helps the doctors look at the genitalia and private areas of a child. It is non-invasive and never touches the child. After the appointment, There's usually a post-exam meeting where the doctors can meet with the child and parents or guardians to discuss any questions, concerns, or evidence that was collected during the exam. By evidence, I don't mean evidence for law enforcement or prosecution. I mean of any significance to the child's health. So you've heard me say SANE a few times. SANE stands for Sexual Assault Nurse Examiner, and it is a qualification for forensic nurses who have received special training to conduct sexual assault evidentiary exams for rape victims. SANE nurses are specifically trained in the medical, psychological, and forensic examination of a sexual assault victim. Having this certification really identifies the quality of training and care that one might receive. In our service area, Thompson Hospital has the largest and most comprehensive SANE program with multiple nurses specifically trained to conduct these sexual assault exams. Prior to receiving an exam, it's important to try and avoid bathing or showering, using the restroom, changing clothes, combing hair or brushing teeth, and cleaning up the area where the crime was committed. This helps best preserve evidence. However, if somebody has done any of these activities before receiving an exam, they are still able to carry on with the exam and have evidence collected. You can expect to have a multiple of things occur during an exam. There will be a physical exam performed by a SANE nurse where evidence collection is taken in order to help identify a perpetrator and collect their DNA. Forensic photography may also be included in the exam. This helps provide law enforcement further documentation of injuries. Documentation of the incident. An exam will start with the nurse going through the story and line of the offenses committed against the victim. The victim will describe the assault in as much detail as they can possibly provide. By telling the nurse what has happened to them, it also helps the nurse identify which parts of the exam should be completed and which ones may not be necessary. During the exam, prophylactics may be administered to a victim. These are medications that help prevent STDs and pregnancy, as well as HIV. Victim support is a key part of all these exams. Medical professionals will explain to the victim that they have the right to advocacy services and offer them to contact on their behalf to have an advocate come to the hospital and help explain all the options available to them and offer support. They will also be given information about the Office of Victim Services compensation claim. So the kit contents. If you've never seen a sexual assault evidence collection kit, it is a big box, and on the outside, you would have basic information to identify who the kit belongs to. Inside the kit is many envelopes, each with a different step. There also includes directions for the medical examiner to make it easier to follow. So what you can expect at the exam and in the kit. There will be several forms in the box. These are things that will document the procedures that were administered, as well as ones that were skipped and why, and also the evidence collected. And there will also be the forms where the victim helps identify and relay their information about the crime that was committed against them. There's going to be many containers, some of which are used to collect blood and urine samples. As you saw in the previous image, there are many envelopes and some paper bags as well. Paper bags and envelopes will be used to hold the collection of clothing and other physical evidence. Not all envelopes will be used during the exam. Some of the steps will include swabs. The swabs can either be of a Q-tip or type of swab, where they may swab the inside of someone's cheek, looking for DNA. They may also have little wooden like sticks almost, where they can try and get DNA out from under people's fingernails. And then there's also other miscellaneous objects, things like a paper sheet. If somebody is coming directly from being assaulted, it may be best to have them open a paper sheet and undress over there. So that way, if any DNA or hair or fibers drops off their clothing or body, it's collected on that sheet. There may be floss, other sticks, glass slides, saline solution, and also combs. DNA samples from the head of the victim will be used to determine the differences in DNA between the victim and a potential perpetrator. Patient rights. There are many things that patients aren't always aware of, and some that can make a huge difference and impact to them. A patient can request an advocate at any time. They may not arrive to the hospital with an advocate, and they may not even want one initially. But once the exam starts, they may want to stop the exam and change their mind. They have the right to do that, and an advocate should be called if the patient requests one. The patient also has the right to postpone the beginning process of their exam until an advocate arrives. The patient can also deny any or all pieces of the exam. If the patient doesn't feel that a specific swab or culture is necessary, they may tell the nurse or doctor that they wish to skip that one. If at any point in time the patient decides that they no longer want to continue with the exam, they also have that option and that right to put an end to the exam or to ask for another provider. You do not need to provide your own health insurance information, and you cannot be denied an exam due to lack of insurance. The Violence Against Women Act made it possible for all SANE and evidence collection sexual assault exams to now be free. You do not need to report the assault to law enforcement. You have time to decide if you want to report. Just because you are seeking a medical exam does not mean that you want to press charges or report the crime. If, however, later on, a week, a month, even a year goes by and you now decide that you are ready, willing, and able to file a report, you can still do so. I want to share with you a couple statistics and another quote from a survivor. Every 73 seconds, an American is sexually assaulted. Of those who report sexual assault, 54% of sexual assault victims are ages 18 to 34. From ages 12 to 34, you are almost 80% more likely to be a victim of sexual assault than older adults. Survivor Brad said that his experience with a SANE nurse in clinic was truly elevating, truly healing. No words to express my gratitude. You made it all such a pleasant experience. I celebrate you and thank you. I also want to share with you that if you are looking for more information on how best to support sexual assault survivors, we have an upcoming live webinar on Tuesday, July 28th from 10 to 11 a.m., where we will be hearing from Christine Crawford, a SANE nurse at Thompson Hospital. Chris will be discussing how to best support people who have experienced sexual assault, how to make a referral and answer basic questions that victims may have about an exam, and how best to support them through the process of the exam and follow-up. If you would like to attend this live webinar, please email myself, Sara Flack, at sara@cacfingerlakes.org to register to attend. I hope that you found this webinar informative and were able to get something out of it, even if at the very least, now you just have a basic understanding of the differences between a SANE and REACH examination. If you have any other questions, below you will find my email, phone number, and our website for more information.